Well, that's a hard act to follow. I must firstly acknowledge the member for Hastings and his wonderful, empathetic and caring contribution that he always gives in this chamber. And he certainly reminded me with regards to the new parent concerns that you have when you first turn up to the hospital when 6.5 years ago now with my partner Donna and all are on the way. And that worry and concern that you have when you go in there. But as soon as you go in there, you're surrounded by people, professionals who on a day-to-day basis know how to look after you, know how to make sure that you feel the confidence that you're going to be looked after, that you're going to be okay. And as hour after hour after hour, and we got up to 25 hours, where you're still concerned, still worried about what's going to happen. You just have that confidence that our nurses, our midwives, our doctors are there to ensure that we get the best outcomes. And I'd like to start by thanking the nurses and midwives that looked after us through some concerning time, but we got there and we got our little bundle of joy at 11:38 p.m. after 26 hours of that ordeal. But I thank them for what I've got today. So it is a pleasure to rise in favour of the Safe Patient Care, Nurse to Patient and Midwife to Patient Ratios Amendment Bill 2025. And from the outset, I'd like to thank the Minister for Health and her team for the efforts of bringing this important legislation to the House. And I trust these changes will make a positive impact for all Victorians. Now, back in 2015, just 1 year into the Andrews Labor government, a significant piece of legislation was introduced, one which would transform our healthcare system, a national leading change that we proudly stand by, and more importantly, that we improve on today. Acting Speaker, that was the Safe Patient Care, Nurse to Patient and Midwife to Patient Ratios Bill 2015. And this was the first time that an Australian state enshrined nurse and midwife to patient ratios into law. And I want to take a moment to quote a few lines from then Health Minister, the Honourable Jill Hennessy, because they are so relevant in today's context. This bill is an Australian first. It will help nurses and midwives do what they do best. It will guarantee every Victorian patient the care they need, and it will protect the integrity of our highly respected nursing profession into the future. She goes on to mention that there is evidence that if a nurse has more time to provide care to a patient, then the risk of that patient having an unintended complication or event, like falling or developing a pressure ulcer, is far less than if a patient was left unattended. In essence, she was highlighting the incredible work that our nurses and midwives do, and how through appropriate legislative frameworks, government can support the incredible contribution that they make to our state. Members may note that the distinct similarity between the titles of that piece of legislation and the bill that we are debating in the House today, and that is because the Allan Labor government is building on the progress that has been made by ensuring stronger and safer ratios. We recognise there is always more to do to improve patient and carer safety and satisfaction, and it is critical that we institute better nurse and midwife to patient ratios to ensure the best possible care for Victorian patients and their families. We made commitments in 2014, and we delivered them through the legislation I began my contribution with. We also made that commitment again at the 2018 election and delivered them. And now we are once again delivering on our commitments made at the 2022 election. It is already our third round of improvements to legislated minimum nursing and midwifery staffing levels in public hospitals, a record we are very proud to stand on. Part of our promises to improving the quality of our health services in Victoria were to deliver a broad package of additional care and support for patients. Through this, we will deliver an extra night duty staff in high dependency units and coronary care units, an additional 457 nurses and midwives into the health system, 30 more residential aged care nurses, the recruitment of 141 midwives, and the trial of a neonatal support nurse in maternity wards. And these are broad-ranging changes which in part has come about thanks to the continuing and ubiquitous advocacy of our nurses and midwives. And we are proud to stand alongside them because we have their backs. I quote from Lisa Fitzpatrick, Secretary of the Australian, Lisa Fitzpatrick AO, Secretary of the Australian Nursing and Midwifery Federation. The government has demonstrated once again it is really listening to nurses and midwives to recover from the pandemic and improve the system for all Victorians. This government also understands that to deliver on these commitments, we need to recruit more nurses and midwives. As the demand for services get higher, it is important that we address the pressure that are placed on the workforce. They are making an honourable and commendable decision, choosing to serve public patients in public hospitals, and it is only right that we continue to encourage them in their career aspirations. Since we've come into government, we've grown our healthcare workforce by nearly 50%, with a 6.7% increase just last year alone. In real numbers, that's an additional 40,000 nurses, midwives, doctors and allied health professionals and other hospital staff. And that is 45% more nurses and midwives and 78% more doctors serving in our public health system. And importantly, nearly a quarter of these new positions have been in rural and regional areas. A $270 million investment has been made for studying in nursing and midwifery free, an incredible initiative to build the supply and capacity of our workforce. And this stands alongside how at the last state election, we promised a $5,000 sign-on bonus to those nurses and midwives who chose to enter Victoria's public health system. And I do go to a very close friend of mine who in her 30s decided to go back and studying nursing. And unfortunately, she started her course a year before that she was able to actually get that sign-on bonus. But she's now looking after patients, working in our public health system, and I thank her for the work that she does as well. The 2024-25 budget increased its investment into building Victoria's public health workforce with an additional $183 million, and there has been an over 50% increase in the paramedic workforce since we came to government. Furthermore, Lisa Fitzpatrick of the NMF also makes important notes about the fact that increasing the numerical number of staff alone is not good enough. There must be legislative action to address issues pertaining to staffing levels, rostering and workload management. And that is exactly what this bill goes through, Acting Speaker. I want to make note of a few of the new ratios and regulations that will now be set in Victoria. 1-to-1 nurse to occupied bed ratio in ICUs on all shifts. ICUs will be required to have a team leader and liaison nurse dedicated to it for the very first time. Improving staffing ratios in resuscitation cubicles in EDs on morning shifts, down from 1-to-6 to 1-to-4 midwife to patient ratios in postnatal and antenatal wards on night shift, and in-charge nurse on night shifts in standalone high dependency units and coronary care units. Acting Speaker, we're already seeing the benefits of this government record investment into our healthcare system. Victoria is ahead of every other state in its planned surgery turnover rate, and we are the only jurisdiction that has performed planned surgeries within clinically recommended timeframes for all Category 1 patients. Category 1 patients mean those that need immediate treatment. And I was delighted to join the member for Box Hill and the member for Ashwood in welcoming the Minister for Health to the Blackburn Public Hospital. And for some context, in 2021, this government converted this site from a privately run operation into a publicly run facility. Now operated by Eastern Health, this year alone, it will deliver around 4,000 additional surgical procedures and 10,000 medical consultations. And it is only through decisive and reforming government agendas such as this that we have seen the wait list decrease almost 10% compared to the same time last year. And that's part in thanks to our $1.5 billion COVID catch-up plan for surgeries that were delayed, and almost 50,000 patients underwent planned surgery in the last quarter, resulting in the lowest level of Victorians waiting for planned surgery since the beginning of the pandemic. The median treatment time in emergency departments is down 8 minutes to 14 minutes, a significant improvement as a result of direct investment into the incredible healthcare workforce we have here in Victoria. And I have so much more to talk about, but time is getting... extension of time, member for Kew? No? We know just how much of a difference these changes will make in supporting our incredible healthcare workforce, deliver safe and high-quality care for all patients in Victorian hospitals, and I'm proud of the work that the Allan Labor government is doing to protect and support Victoria's public healthcare system. And I want to thank all the nurses and midwives for everything they do for the people of Victoria, and I commend this bill to the House and wish it a speedy passage.